You didn't want to get into fertility out of medical school. How did this evolve?
Very good question. So I always wanted to be a physician, but as a guy, I never met an OBGYN, and so therefore I didn't know anything about fertility. But I was more of a surgeon, and I liked high tech, and I really liked to get to know my patients very well. I didn't want to just take a gallbladder out or an appendix. I wanted that conversation with the patient, and that's what drew me to obstetrics and gynecology. Like at some point, you don't want to get pregnant, then you want to get pregnant. You want to block your tubes, or so you want to make sure they work, and you want to not use contraception or so. So I like that. I like to know my patients very well. And within OBGYN, at the top of it is going to be fertility, because it's so individual. And so you have this skill. It's completely man-made, because as technology comes along, new options come along. So I figure I'll never be bored. I'll always be challenged. And usually ethics and are way behind. And so technology is always ahead. And it's that comfort. At what point as a society do we feel comfortable with a certain technology and introducing them into the real world? And so if you combine that with the desire to be a parent and how everyone wants to build families differently, you just have never-ending options, so it's never boring.